Actually, simple, practical lifestyle tips which I can give to your audience. One is dehydration. The kidneys, they filter about 1 liter of blood every minute. So in a day, they are filtering 50 gallons of blood. It's a lot of work, a lot of output they have. So it's a very vascular organ. So if you are dehydrated, your blood flow to the kidneys will be low, and that causes the clogging of your filtration system.
Thank you so much for joining us on another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner, and today is brought to you by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, and highly effective approach to optimize wellness. It's a wearable device that puts frequency better based life in your hands and on your wrist. Make sure to stick to the very end because we've got a wonderful surprise for you, a lovely giveaway. But you're also going to want to stick to the very end to listen to every word this woman has to say. I'm so excited that we're actually having somebody talking about something a little different on the show. I don't think we've ever had anybody talk about kidneys and kidney health and why should we care and there's such a huge part to overall wellness that I think are kind of like unsung heroes. I don't think enough people are talking about kidney health. So I'm super excited to have Dr. Sharma on the show today. Welcome her.
Thank you, Heather. Thank you for having me.
Yeah, absolutely. So tell me a little bit, where are you calling in from today?
I am in Michigan,
Okay, what part of Michigan?
in the South Detroit metro area.
Okay. I love talking to people from Michigan and you ask them where they're from and they take out their hand, right? To show you where they're at, if it's anywhere
Yes,
else other than Detroit. How long have you been in that area?
it's been about 20 years now.
Okay, long time. Um, so tell us a little bit about your background. How did you get into being a doctor and focusing on kidney health and all that fun stuff?
Yeah, so I don't know how much time you have, but as a child, when I was growing up, my parents always, found that the education is very important in our house, and they wanted me to become a doctor. And when I was applying for medical school, I found out that my uncle was sick from kidney disease and ended up on dialysis. That's how I chose my path to become a kidney specialist, because I thought that becoming a kidney specialist is my calling. I will, help all those people who are suffering from kidney disease, prevent them from going to dialysis. And my uncle passed away with the complications related to the kidney disease during my medical school. And after I finished my fellowship at University of Cincinnati and became a nephrologist, I found out my mother-in-law also had a kidney failure on dialysis. So she passed away recently during the COVID, and so did many of my fragile patients. So that's how I discovered functional medicine, because I felt that my conventional medicine, just giving the prescriptions and disease care, is not making a difference in my patient's health.
Oh,
And
absolutely. And after reading through your bio, I kind of figured there was a pain to purpose story in there somewhere, because is like, oh, I just want to focus on the kidneys. So I'm so sorry to hear that that happened in your family, but it was also great that it spurred you to go in this different direction. Because like I said, they're like an unsung hero of the body. And, again, there's not really a lot that Western med can do for you when it comes to kidney stuff. It's totally different. I get it. But, even my cat died of kidney disease at a way young age, and it was absolutely heartbreaking. And she wasted it away, and it was just absolutely heartbreaking. And so
oh,
I've
I'm
always
so
been
sorry.
fascinated with kidneys and the kidney function as well. So when did kind of what was the aha moment that spurred you into functional medicine?
Yeah, so as I mentioned that during the COVID, I realized it was the eye-opener era for me, because I lost a lot of kidney patients. They are suffering from multiple comorbidities, and they are the most fragile patients you can have, because they have like heart disease, they have diabetes, they have other comorbidities, which made them very, very vulnerable. And when I lost them, I found out that, this conventional medicine, which I'm practicing for over 15 years, is really not making a difference in my patients' lives. And I'm just handing over the medications after medications to help them get better. But nobody's looking at the root cause why people are suffering from kidney problems. And it's a pandemic going on, and there are trillions of dollars from healthcare are going into dialysis, into transplant. And why not we, catch this problem upstream and prevent that to happen, so that patients don't end up with the severe kidney issues? Why not to prevent the kidney problem, right, at the first place? So that's how I started looking into the answers for that question. And I discovered functional medicine, which is a root cause medicine. And when I started applying those principles on my practice, as well as the patients who are coming to me through telehealth, I found out it's really making a profound difference in their outcomes, in their longevity, in their health. And it's not about fixing a problem, it's about preventing them going into kidney failure or kidney disease at the first place.
Can I get an amen? Oh my gosh, absolutely. And it's so sad because there's even a lot of doctors that even after they're presented with these kind of truths, they still don't kind of wake up and look around and go, gosh, I wonder if there's something else there because, the way medical school is set up and, the hours and the long years, I mean, it's a perfect mixture for kind of a certain level of brainwashing, right? Like there's no other way. This is the way, right? This is the way. And so for you to peek your head up and go, I wonder if there's another way. Like, kudos to you. That's very brave.
No, I think my personal story was also related to it. I don't think many doctors they have this kind of a story where you have an encounter with your own family members going through the process, because it's a toll not only on the patients but also on the family. And dialysis is not a pretty sight, it takes out all your energy. You have left nothing in you after the dialysis session. So you can't really do much. And I have seen that first-handedly with my family going through it. So that's how, I started looking for answers and started, outside the conventional medicine to find those answers, which I believe that it's making a difference. And I feel like that I am, accounting for a difference in the health of my patients. And it's important for me because it's more satisfying, and I can go to bed with my peace of mind that I'm making a difference.
Absolutely, absolutely. And I hate to just change the subject for a second, but I absolutely adore your accent and I love the way you say fragile. Like it's just so it took me a second when you said it. I was like, what did she just say? I'm like, oh, fragile. But it's just adorable. I love it. Don't change it ever, ever. It's so cute. I know a lot of people when they come to the States, they're like, oh, I'm trying to get rid of my accent. I'm like, why? Although I get now being a foreigner how different it is now that I'm living in Mexico. Oh my gosh. Like I tell my story, 100,000 times and I've only lived here for 4 months, so it's going to be crazy how, it's different living in another country and you don't speak the same language, you have a different access than them because you're an automatic target for, ooh, who are you? Why are you here? What brought you here? Which is all great, but man, I swear, some of these bus tours that I take, I feel like I want to stand up at the beginning and just be like, here's the story, to the whole group because I end up saying it like 10 times throughout the ride. It's
That's
crazy and
fun.
fun, right? So let's take a quick break. When we come back, I want to dive deeper into, yes, we know the kidneys filter, but there's got to be so much more to the story that I want to dig deeper into when we come back from the break. So don't go anywhere. Stay tuned. We'll be right back.
There's a new word for wellness, Nikki. Nikki is your personal wellness companion, a sleek wearable device that lets you choose from a variety of programs to match your day. With a simple tap on the Nikki screen, you can explore wellness programs created for different moments and lifestyle. Need a lift? Select energy. Looking to unwind? Tap stress and anxiety. Want to feel more at ease? Choose pain. Heading out on a trip? Try travel to help you feel ready for new adventures. From busy mornings to quiet evenings, Nikki puts a variety of wellness experiences right at your fingertips and on your wrist. Life moves fast. Nikki moves with you. It's a portable way to bring wellness technology into your everyday routine, wherever life takes you. Your day, your choice, your wellness program. Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
Fantastic. So hopefully we piqued your interest enough to, follow along with us and being like, oh, well, there's another way than dialysis. So let's break this down. Well, first off, let's just, for folks, who might be kind of newer to this conversation, tell us a little bit more about the kidneys and why they're so important.
Yeah, so many people think that kidneys are only, filtering your blood and making urine, but that's not true. Kidneys are actually doing a lot more. They are your endocrine organ, which actually balances your hormones, and it produces the erythropoietin hormone, which causes the production of your red blood cells. So if your kidneys are sluggish, you will be anemic and you will have low energy. So that is all related to the kidneys. And also, kidneys help you balance your minerals and electrolytes, which has direct effect on your blood pressure. So renin-angiotensin system, which is also called as RAS system, so the whole cascade of hormones are regulated by your kidneys. They are, the chemical lab of your body because they are maintaining a certain amount of pH acidity in your blood to have your metabolites, your enzymes work at the optimum level in your body. So it has more than just filtering your blood and the toxins functions. It regulates your blood pressure, your minerals, your electrolytes, your hormones. It also has effect on your metabolism. So insulin sensitivity increases with the healthy kidneys. If your kidneys are sluggish, you will start developing all that inflammation, insulin insensitivity, and it causes the metabolic syndrome. So I have seen that over the period of time, over many years in my patients, and it is a very important but ignored organ in the body.
I'm already like, she's dropping so much knowledge on me. Like my brain's going, what? I didn't know the kidney was part of the endocrine system. Like, how did I not know the kidney was part of the endocrine system, which, yes, regulates your hormones. That's crazy. How did I not know that? But so thank you for that. And that makes a lot of sense. And I know there's so many people out there, we talk about obesogens a lot on this show because, toxins, making it impossible for you to lose weight. So obviously they're going to create a higher load on your kidneys as well. And if your kidneys aren't working properly, then it's going to have a harder time losing weight because there are so many people are having such a hard time losing weight these days. Like the deck is stacked so far against them. So tell us a couple other things that the kidneys kind of directly have a tie into.
Yeah, so the kidneys are actually important to activate your vitamin D, which is essential for your calcium metabolism, for your insulin sensitivity, and fat metabolism. So when the kidneys are sluggish, you won't have active vitamin D. You will have increased cellular clogging at the mitochondrial level. There will be increased toxins developing in your body, causing inflammation. So your insulin is not gonna be sensitive to all these, the cells are not going to be sensitive to the insulin, and there is a leptin hormone which is going to be skyrocketed, which means that you will be hungry all the time, and you will be feel like eating all the time. So that is all related to your kidneys. Also, brain fog is a big thing, with the kidney patients I have dealt with, that they are suffering from low energy, brain fog, and that happens because when the toxins they accumulate in your blood, the urea, it crosses into your brain, and that it causes the neuron toxicity, and that causes low energy and brain fog. So it has indirect effect on pretty much every organ in your body.
So if you go back and rewatch this and you see her start getting these little grins on her face, it's because she's watching my face like have these like what moments as she's talking because I'm not on camera because she's blowing my brain away. And so I'm watching her with these grins and it's so cute. But I just had no idea it had anything to do with your vitamin D levels as well. And it's funny because I've had these kind of leptin issues and I've been told very recently that I had some issues with kidneys and that sort of thing. And so now I'm kind of like tying the pieces together as we're talking. I've been doing microdosed compounded GLP-1s for the past year because I was having such a problem. And the minute I started going off them, the leptin, it had to have been like the food noise came back. I was just like hungry all the time. I'm like, what is this? This doesn't make any sense to me. So thank you for that. So now I would love to know what are some of the practical lifestyle thingies that you can do to kind of help your kidneys along? Because now I'm curious. It's like, what am I missing?
Yeah, it's very actually simple, practical lifestyle tips which I can give to your audience. One is the hydration. The kidneys, they filter about 1 liter of blood every minute. So in a day, they are filtering 50 gallons of blood. It's a lot of work, a lot of output they have. So it's a very vascular organ. So if you are dehydrated, your blood flow to the kidneys will be low, and that causes the clogging of your filtration system, which means your toxins start developing, your kidneys become sluggish. So hydrate yourself. Sometimes if you don't have a blood pressure problem, you can put a little bit of electrolytes, like a pinch of salt in the morning, some lemon, just sip throughout the day. Don't just gush it in, because your kidneys need that water throughout the day. So pace yourself, hydrate yourself. That is the number one tip. Number two is stay away from pain medications. Believe it or not, the over-the-counter painkillers like Aleve, Motrin, ibuprofen, they all impact kidney health. They can cause gastric ulcers, they can cause cardiovascular problems. They are not good to take on a regular basis. Yes, once in a while, if you are having some kind of pain, you can take those, but not on regular basis. So they are not kidney friendly medications. Tylenol is okay to take. And then, believe it or not, the sleep is very important. The stress management is very important for good kidney health as well. It directly impacts your glymphatic system, which is the clearance pathway in your brain. And the brain kind of washes away all the toxins during the night in the deep sleep, when you are in deep sleep, into your lymphatics, and through your kidneys gets filtered out. So everything is linked together. So stress management and sleep is also very important.
So yeah, really want to reiterate hydration, right? Because we talk about it a lot on this show because we talk about constipation and pooping. So now if you've got both of your detox, 2 out of the 3 of your detox pathways not working properly because you're dehydrated, right? Like that's going to cause massive issues. And it's crazy to me how many people's brain fog is literally because they're full of shit and their urine, their kidneys aren't working properly. Like it's crazy how their brain can come back, but we've kind of like this frog in the pot analogy, right? Where we're slowly turning up the heat and we're taking these things on as normal parts of aging, people thinking dementia and Alzheimer's and, the brain fog is just a part of aging, when a lot of times it is this lifestyle stuff that they're missing that most people aren't talking about. So if you are having symptoms, right, no matter how common they may be, there's always something, your body's check engine light saying, I need help in here. So please listen to that, your body's check engine light. So how amazing that there's simple little things that you can do to help turn some of the stuff around. I think for me, it was a lot of the pain stuff because when I was younger, I was undiagnosed Lyme disease for many, 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 many years. And I remember popping a lot of that stuff like candy, didn't even, not think anything of it. It was the only way I could exist. So yeah, I could see some damage happening from that. When you damage your kidneys, how well do they turn around?
Yeah, so if it is, acute kidney injury, which we call, within like 3 months of the insult which happens to the kidney. Maybe it's dehydration, maybe it's the pain medication, maybe some antibiotic which affected the kidney. Then usually if you take away that insult, the kidneys can turn around and they can heal. But if it is, the chronic kidney disease, you can optimize the kidney function, but sometimes, fibrosis happens in the kidney and it's hard to turn around the complete function of the kidney. You can still get it better, whatever the reserve, kidney function is there, but you cannot go back to 100% because of the fibrosis.
Okay, okay, good to know. This is a little kind of, it just got my head thinking a little bit because everything's connected, right? So how much when you're looking into kidney health, are you also talking about like pelvic floor type stuff? Because I'm noticing as I'm getting older, right? I thought I was having a UTI and it turns out it wasn't a UTI, it was pelvic floor stuff. And so, again, it attached to the bladder. So how much are you working with folks when it comes to like pelvic floor stuff and the kidney stuff?
Yeah, so I'll give you an example. I had like a 75-year-old lady who came to me with UTIs. She has been to different OBGYNs. She has been to different doctors. Nobody could figure out why is she getting urinary tract infections. Her bladder studies were okay. They're not like completely normal, but they were okay. They were not showing any reflux or anything or retention of the urine, which could cause urinary tract infections because the longer urine is staying in your bladder, it's the like a nidus for the bacteria to grow, and that can cause UTI. But in her case, I was, when she came to me, I'm like, how long do you have been getting these recurrent UTIs for? She said years. I lost count, and I have been on outpatient, oral antibiotics so many times, and it upsets my stomach and stuff like that. So I just asked her, like, how is she cleaning herself? It's a simple thing, right? It's the hygiene. So she was cleaning from back to front. So of course, all the bacteria from the back is getting into the front, into her urethra, causing the UTI. I just gave her that tip of, cleaning herself from front to back, always maintain a hygiene, use cotton panties, and hydrate herself. Cranberry juice is good. So all those like small lifestyle changes with some kind of nutrition, which I told her at that moment. So after implementing all those things, she came to me in 3 months. She said, Dr. Sharma, even my OBGYN couldn't help me. And I didn't have any UTIs for last 3 months. I'm very surprised. So that was like a simple thing, right? So there are so many reasons you can have urinary tract infections. Yes, pelvic floor dysfunction can cause your bladder dysfunction, and that can lead to urinary tract infection. So it is important to take care of your pelvic floor. Kegel exercises is, something I recommend to people who are going into menopause after 60 years of age to help them regain their pelvic floor function. And it helps with the bladder also. Hydration, cranberry juices, staying probiotics and prebiotics are very important to maintain those healthy gut bacteria, healthy bladder bacteria, and that can fight against the bad bugs.
So thank you for going along with my brain fart because we were talking about kidneys and I went into bladder, then went into pelvic floor, but they all really are tied together. So I appreciate you going down that stream, even though it was a little sidetracked. I know you have a filtration reboot protocol because I know a lot of folks, that are maybe even hearing for the first time. They're like, wait, what? I can churn some of this stuff around. I don't have to live like this, or I can prevent this, or any of those things. So talk to us a little bit about your reboot protocol.
Yeah, so I have developed this filtration reboot protocol. I'm very excited about it because, people think that your health is related mainly with your liver, with your gut. We have so many gut protocols, we have liver protocols, but nobody is talking about your internal filtration system. So I call it internal filtration system, three parts, which is your kidneys, which is the main filtering organ in your body. And it's playing a very important role with endocrine organ as well as a metabolic organ in your body. So it is important to regulate that filtration. And the second part is the cellular clearance pathways. When the cells they become, little sluggish, they have their internal clearing system through autophagy, through proteostasis, which is, maintaining the quality of protein inside the cell. So when we have that clog, it causes more inflammation, it causes, damaged DNA, it causes chronic diseases, and that is also related to your overall filtration system. And the third part is your glymphatic system, which is your brain clearance pathways, which I touched upon earlier because, your brain is also very active and the neurons they are producing some byproducts in the form of amyloid or tau or some protein byproducts, and they have to be washed away into your cerebrospinal fluid, which is the fluid which surrounds your spine and your brain, and through that into your lymphatics and the kidneys. So all those filtration systems, they are very important. And unless we take care of them, we cannot fix the metabolism, we cannot fix the inflammation in the body, and we cannot fix the chronic diseases you're having. So I have developed this protocol where I'm utilizing the functional medicine as well as my nephrology, physiology into together with the conventional medicine to help people recover from the chronic inflammation and metabolic syndrome so that they can clear up those pathways to help them regain their vitality and their health.
Awesome. So, but what does that actually look like? So what is the actual protocol? I'm imagining it's some supplements and what else?
Yeah, so it has different parts to it. We look at the root cause of the problem, right? So if you're suffering from, suppose, blood pressure problem or heart disease problem, so your kidney heart axis is disaligned. We look at what is causing it. So one is the functional lab discovery to find out the root cause of the problem. And then we take that patient with the personalized protocol depending on where we are finding the problem. We have to fix it through the lifestyle changes, stress management, sleep and circadian rhythm regulation, hormonal balances. If you have a leaky gut, that can cause a lot of inflammation, that can affect your filters in the body. So your kidneys, your liver, your gut, your sleep, your lifestyle and nutrition, everything has been taken care of in this protocol. So that's how we design that personalized protocol for a patient.
I love that. And then, obviously with the Nikki, you can use the inflammation and the detox uh frequency to kind of help that system along as well. So that's incredible. So we're getting to the time of the show, the shameless plug time. Where can people find out more about you and look into this protocol, the filtration reboot protocol, to see if it's a right fit for them?
Yeah, so they can go on my website, zealvitality.com. I'm giving them free discovery call at this time, so they can schedule a free 15-minute call to see what health problems they're suffering from and if this is a right fit for them. Or they can also email me at staff@zealvitality.com. I am on social media with the handle of at the Kidney Whisperer and on Instagram, Zeal Vitality, on Facebook. I have YouTube, Zeal Vitality. So all these channels, they are open for anyone who needs help.
Fantastic. Thank you so much. And I know, I've been in this field for a long time and she dropped quite a few new truth bombs on me. So I know you guys have got to be all kinds of new amazing things, and what's possible. And that's what I love about the show is that it gives people hope again. Because like I said, a lot of times if we get caught in that kind of Western med thinking and there's only one way and there's no way out, we can lose hope. And so we love doing these types of shows so we can give people hope again. So I want to thank you for doing what you do.
Thank you for having me.
Also, make sure to go to wearenikki.com/podcast, enter in BioBeats to get 10% off of your Nikki. And because we really love our customers, and the way we show appreciation is we give away a free Nikki device and a wellness suite of frequencies. It's a $598 value on every show. So go to the show notes, look for her reboot protocol, her filtration reboot protocol, and also enter in to win. Congratulations to our October winners, Stephen L., Madsi O., Sue C., and Arika F. Congratulations, you won a free Nikki device with the wellness programs, a $598. Yay! Congratulations. And if you didn't win this time, don't lose hope. Keep listening, keep entering to win, keep sharing the love. Please like, share, and subscribe. That is how we get this message out to the world. Thank you again for joining us, and have a healthy day.
Nikki Wellness Technology. Delivering frequency enhanced health.
It's got so many options. I'm just going to go over, it's like a menu that you can choose. It's so easy to use. You just click on what you like. For example, it's got travel, pain relief, energy boost, allergies, trying all the frequencies.
This is my Nikki. It is a bioenergetic wearable that works by emitting a specific frequency carried by a red light, as you can see on the back. It's aimed at enhancing the body's natural healing process to improve wellness and reducing stress, pain, and inflammation. And to select a frequency, you tap it to wake it up, and then you slide to the screens that list the different frequencies. I have wellness or Lyme on mine. So if we want to pick one, we just tap on it, and you'll see the circles around, and there's a play button, play areas, tap there, and you can see the colors radiating that show that it's playing, and you would also see the red light on the back. And to stop, you just tap it again, and then you can slide and select a different frequency. I'm going to play afternoon. And you just tap, and away you go for your afternoon.
So they're two different things. You have the Nikki device, and then you have the frequency sets. And so right now they have the wellness set of frequencies, and they have the Lyme set of frequencies, and both of them are absolutely incredible. I use both sets on a regular basis, so I absolutely love them.
Nikki Wellness Technology. Delivering frequency enhanced health. wearenikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.